Hello, everybody. Welcome back to the show, Science Dispatch Podcast. My name is Cameron English, your host as always, joined by Dr. Chuck Dinnerstein, Director of Medicine at the American Council on Science and Health. Chuck, what's going on? How's the East Coast this morning?
East Coast is a beautiful place today. It's fall. It's fall in the air. The last 10 days have been gorgeous. Can't complain.
I am very glad to hear that. It's been an exciting morning. I have my young daughter with me, so if you guys hear cooing or whining or just someone expressing their thoughts in the background, that's her. It's a fun experience. I heard a rock star one time say, "What keeps you humble?" And he said, "My kids keep me humble because they don't care that I'm rich and famous. I'm just dad and they want a popsicle."
Yes. Let's have it now, buddy.
Yes. Yep. That's it. So if you want to work on your ego, have some children because they don't care how awesome you think you are. Okay. This story, going to be a tough one. Not going to lie. It seems to be a habit of mine lately is writing about topics that make people uncomfortable. But that's okay. I think it's important. So the story is called Pediatrics for Hypocrites. The American Academy of Pediatrics slams glyphosate, endorses gender-affirming care for kids. So, the fun thing here, and we had this discussion before the article was published, that, do we really need another article about glyphosate? Because this weed killer is a perennial topic if you're in the science communication, science outreach world. Everybody talks about it. Everyone has an opinion. Everybody tends to repeat the same things over and over. And even as someone who cares a lot about that topic, I find it obnoxious. It's tiring to constantly go, yeah, it's safe, no risk, IARC study bad. Like, it's obnoxious. I get it. So we debated whether or not to move forward with this, but I think I ultimately went with it because I think the hypocrisy on display here is really problematic. So on the one hand, the American Academy of Pediatrics says, this pesticide is potentially dangerous because it's used with genetically engineered crops, which are consumed by everybody, basically. And it's a potential endocrine disruptor. And the science behind that claim is awful, to use an unloaded word. But on the flip side, of course, we've got this gender controversy that is, close to a decade old at this point. And you have groups like AAP coming out and saying, we fully endorse gender-affirming care. And specifically what we're talking about that's most relevant here is giving kids puberty blockers or cross-sex hormones. And of course, by nature, when you prescribe those drugs in these settings, you are trying to disrupt the endocrine system. And we can talk about the specifics of that, whether that's good or bad or whatever. But, the hypocrisy is what gets me. And it's personal to me because when my wife got pregnant with our first child, it's about 4 years ago. How do I put it? I looked up to AAP, like when I had a question about food safety or vaccines or SIDS, whatever, that was my first stop was their website. And then I would read what they said. And then we'd go to our pediatrician and I would say, break this down, explain to me how this applies to our situation. And so that was a good combination as you're entering fatherhood or motherhood, right? It's a scary process. There's all kinds of uncertainties. When you ask people about serious questions, sometimes they just go, I don't know, like we just don't know. And that's a horrifying realization that as you're bringing someone into this world, the people with the letters after their names who you genuinely trust, they just don't have an answer sometimes. So I found that going to them sort of alleviated that concern because I could familiarize myself with whatever. Anyways, the point is that over the last few years, they have become increasingly partisan and ideological, which isn't necessarily bad. Everyone's entitled to an opinion. But what I found is that they're doing it in spite of the evidence in many cases, and in a way that jeopardizes the health of children in some instances. And then at minimum, they're just misinforming people, especially on the agricultural side, right? They're telling people that their kids are potentially at risk, and so they should go spend an extra 20% on organic food if they can afford it. And that really, really bothers me. So there's the setup. Chuck, of course, you're the physician here, so curious to get your thoughts.
So as you may expect, I'm going to have to disagree and speak on behalf of my clinical friends. I think that there's two different issues in here, and we can argue about whether one is more scientifically valid than the other. But let's put the glyphosate stuff aside and get right into the use of endocrine blockers for gender-affirming care. And I go back to what you wrote in the article about what the AAP was saying, that young transgender youth should have access to comprehensive, gender-affirming, and developmentally appropriate health care that is provided in a safe and inclusive clinical space. And I think that it's very hard to argue with that as a value. I think that when you talk about using endocrine blockers for a medical indication, that's certainly different than their wholesale throwing GMOs aside over some potential problem with an endocrine disruptor. I think if we take the endocrine disruptor words out and look at this, in one sense, we're talking about what a pediatrician should do in terms of appropriate care for the patient across from them. And one of the places where I disagree, I've had this disagreement with Josh when we talk about pain patients and Henry with other times, is that I have a hard time identifying a physician in the community that is willing to take a social stand that is not backed up by medicine, because when they take a social stand that has a real life medical effect, they're held liable for that medical effect. And arguing the social justice or not of that is not going to have any play in those kind of tort cases. So my experience as a community physician has been that when I'm looking at controversial therapies, I very well may apply them, but I certainly do go a long way to spend time to making sure that there's an informed consent between me and the patient about what we're going to do. And I have a real problem imagining that there's a lot of pediatricians that are willing to risk their license and a lot of money over giving somebody hormones over the objections of their legal guardians.
I love the show because Chuck and I can amicably disagree. And then you realize you're like, it's not that big of a deal. You can have different opinions and not hate each other. It's okay.
Exactly.
It's great. So here's my concern, to bring back the endocrine disruption language for just a second. Again, you have decades of clinical experience, and I would trust your insight on how a physician thinks before prescribing a drug, especially to a child. So my question is, how can they look at all of the science around this agricultural topic and go, no, we're going to reject that, and we're really concerned about endocrine disruption. And then in these cases, and they're relatively rare, right? There has been a significant increase, but there aren't millions upon millions of children that are undergoing these hormone treatments. Nevertheless, what's the distinguishing factor, right? How can you partition these and say, I'm going to give you this drug that is poorly studied for this purpose? And I cite the meta-analyses in the article that show that the studies that have been done are of poor quality. They're often qualitative in nature because there aren't a ton of clinical trials, because this is a new phenomenon, right? It was right around 2014 that this really entered the discourse as a medical procedure or medical procedures. So explain that to me, right? What's going on in their heads as doctors, would you say?
I think that they're siloing things. And, you're always I'm always affected by what I'm reading lately. And I just started reading Yuval Harari's book called Nexus, which talks about information as a key driver of evolution at all levels. And one of the things that he writes is that truth is something that brings our attention to certain aspects of reality while inevitably ignoring other aspects. And I thought that was interesting in the context of this conversation, because I think that there are a group of people that have decided that glyphosate is bad because that's how they read the data. And they don't take into account other endocrine disruptors. Sometimes they don't even take into account other data to do that, because they've come to a mindset about what they think is going to be there. And in an all too human way, they mentally cherry pick the data that they wish to have. And so that they're able to hold what we realize is two paradoxical thoughts at one time. One is that endocrine disruptors are bad in the setting of eating because it's unintended, and two, endocrine disruptors are good in the setting of intentionality. So I think that this has to do with the fact that the physicians often are faced with a specific problem and tend to focus on that, and a lot of what they describe as externalities are to other people all part and parcel of it and should be taken into account. And I think that you view this more holistically, say, than the AAP. They got this bucket and that bucket, and that's how they view it. And you say, no, let's look at it. Let's look at it from the point of view of the established science. Then they're, that gives you a different truth, or at least a different point of view, if you don't like the word truth.
I love the word truth. I just wish it was consistently applied. And I don't know. There's so much to say. I think you're certainly right. I think we need to be careful in judging individual physicians. I agree. I think the same thing. Because in specific circumstances, you really don't know what's happening. I think that's true. At the same time, there are anecdotes coming out that are alarming to me. And again, they're not going to be settled for years after the fact. But right, there's the most prominent case is a woman named Jamie Reed, who was a nurse at the University of Washington University in St. Louis. She worked in the pediatric gender clinic, and she protested the way that these treatments were being handed out relatively easily. Right, with like one consult within a couple hours. In some cases, she claimed you had kids being prescribed drugs like Lupron, for example.
Okay.
And so that's alarming to me. I don't know that would happen with almost anything else.
Well,
And so that's what's problematic to me, at least as a dad. I mean, I'm not a doctor, but that's concerning, right? If you take your kid in and within 2 hours, this drug off label is being prescribed to your kid, and you're like, well, I guess if the doctor says so,
I hear exactly what you say, but a lot of times when we're talking about consultations at academic medical centers, there is a lot of data that's already been gathered before they make it into the office of the academician. And so, I'm going to hedge my bet and say that there was a lot more information that they already had available in order to make that decision. Though, it's certainly possible that that somebody's on a mission and a simple request with, a doctor's note from somebody else is sufficient to get them off and running. It's certainly possible. I just have a hard time thinking that most clinicians would stake out that territory. Physicians are pretty conservative lot when it comes to things. I mean, we may be far more flamboyant these days in terms of using social media and things, but all that flamboyance is in service to very conservative treatments. We don't, we're just not wild and crazy people that way. Again, that's been in generally my experience. So it's to somebody that's even more conservative in their medical approach, that person will appear to be a cowboy.
So, I mean, that's probably true in many cases. I think the thing that bugs me, and then this is the new dad brain kicking in for sure, is that, I mean, we're not talking about whether or not it's okay to give your kid a baby aspirin to treat or baby Tylenol to treat a fever, right? I mean, we're talking about drugs with serious consequences. And in some cases, you're talking about infertility, perhaps. You're like and even if the drugs work as intended, you're talking about major physical
Okay.
changes.
But and that's 100% correct. But let's put the counterbalance piece to it. Let's say that, your child is being bullied in school. They're clinically depressed. So, and we know that there's an elevated risk of suicide in this population for a variety of reasons. Now, are all of a sudden those other risks associated with endocrine disruptors, which are reversible or appear to be reversible? I can see that no going there because I get to see the video. Is there a setting in which you would consider the risks to your child at the moment are worth the longer term, not clear risks in the future?
I think for the examples you brought up, I think there's much simpler interventions that work, right? So for clinical depression, there's very good treatments for those.
Yeah,
Everything from talk therapy to SSRIs, which work really well for many people.
yes, but
You know,
the SSRIs come with some side effects too.
yeah, but let's get
Okay.
real, right?
No, no,
Like,
no, no. Okay, so no. So what you're saying is, uh, that's a step too far for me, right?
well, yeah, I think. Well, again, here's the difference, though, right? In with something like clinical depression, you're talking about a real diagnosable condition that didn't pop up on the radar 10 or 15 years ago. This is right. This has been studied for decades, and yes, every drug has side effects. There's no doubt about that. But the question in my mind is, with clinical depression, you're treating a real condition, whereas with gender dysphoria, which is real, there's no doubt about that. I don't know that needs to be classified as a medical condition that you treat with drugs or surgery, right? I mean, you're talking about if a kid follows this pathway through their teenage years and into their early 20s, I mean, you're talking about double mastectomies in some cases.
I it, I hear you loud and clear. But I know people that that were never felt that they were the gender that they had been assigned at birth. And I've known these people since they were kids, and it was eminently clear when they were 8. This was not this was not something that was strange. This just was, and they went on, and it's interesting to see where those lines were drawn because they were kids of a physician, and the physician said, "Okay, endocrine blockers, good. Surgery, bad." That there are steps along the way, and I think you can find people that that take treatment to the extreme, both either on either side of that therapeutic desk, doctor or patient. That's there. But I think that there's at some point there's a place where I would, as a parent, if I saw my child in that level of distress, say, okay, let's give it a whirl. I'm willing to trade some short-term respite from that level of unhappiness for some possible long-term consequences. And that's obviously you feel differently and you're going to do that calculus differently. And all I would argue is that that's all right, and that's between you and the physician and your child. And it shouldn't involve the AAP and the federal government and all the rest of the people that want to hop on board and tell us what to do.
I think that scenario would be more tolerable if that's what were happening. But as we're talking about here, right? You have AAP, you have the federal government funding this, you have major medical centers endorsing it, you have major journals like Science and Nature all getting on board with the ideological concepts that are fueling this, right? This whole fairy tale of a sex spectrum, which is just delusional. The fact that any biologist or geneticist is going to look me in the face and go, evolution is absolutely true, you have to endorse this. Also, there's a sex spectrum. We don't know how many there are. I mean, that's absurd. I don't like, you know what I mean? And the same thing with the gender diversity, right? You can pick any pronoun, you can be any gender. You know what I mean? So it's like,
Okay, so
just one final thought, and then I'll let you jump in here. But
no
you
problem.
have a real social, cultural phenomenon that is shifting or is trying to deliberately shift the way people view this, and that is what bothers me, right? If this was just, one out of however many hundreds of thousands or millions of people that for one reason or another think they were born in the wrong body, at 18 years old, they go, this is the change that I'm making. And I want to be clear, I'm not advocating bullying or mistreatment or neglecting or shaming people. That's not what I'm calling for. But if what you described was happening and you had people, and by the way, you have organizations like WPATH that are saying kids can't consent to these treatments. They don't understand what they are accepting. And oftentimes their parents don't either because they don't understand endocrinology, and nor should they really have to. And that's one of the problems that I have with AAP is that, they will come out with this public statement and then they will commission a systematic review. They're like, yeah, we've already reached our conclusion, but now we're going to go backfill with all the data,
I hear you. Okay, I think there's any number of things we can unpack here. I mean, we can do this talk for a long, long time. You talk about a cultural component, and I'm going to just put that to the side because I think that there's a lot of things going on there that are wrong. Then there's the biological component, and I think that my sense of our human physiology today is that it's the relationship among thousands and thousands of variables at once. So I can understand that there is a spectrum of our hormonal balance, and that we can statistically can say that it's this, but there is a wide range, and across that wide range, there's any number of ways that may express itself. Where you get into problems and where, we'll go back to, arguing back and forth is when you put cultural words on it. When you start saying there's a spectrum to the genders. Well, there's maybe two poles to the genders, male and female. And within that, there is a spectrum of how people present themselves. And I think that a big chunk of that has to do with their underlying genetics as well as the environment that they're raised in. It has to do with their moment-to-moment physiology. I mean, we can look at the athletes and go over it. Anywhere you can do that. So my doctor part says I'm gonna bail on this one, and I'm gonna stick to the biological piece because I feel more comfortable in discussing it from there. The cultural part is a whole different set of questions, and it has to do with the rise of the concept of grievance, the rise of victimization. I mean, we're talking about a vanishingly small portion of the population here, and they're getting an inordinate amount of press for the size of the problem because it's titillating and it gets eyeballs. At the same time, it is a interesting area for academic physicians to explore on the research side and the clinical side because it's not the usual problem. And in academics, we've already dealt with the usual problems, and there's that. If you want to, get your funding and you want to get advancement, then you look for a problem that has been ignored. And this is a problem that's been ignored because it's not a huge problem, and it's gotten funding and so on and so forth for a lot of cultural reasons now. I'm a middle path kind of guy.
I know, and that's fine. That's fine. And it's like I said earlier, right? It's okay that we disagree. You don't have to agree on everything. I think though that the concern, as we wrap up here, I don't want to keep folks too long. There may be individual cases where maybe this makes sense, right? And I've heard some physicians say, like someone with a disorder of sexual development could have access to this, right? They should, right? If you're born with ambiguous genitalia or something, and that carries real, real challenges. It's awkward. It could make your life much more difficult. So in that case, this treatment makes perfect sense to me. Like going all the way to these sex reassignment surgeries or whatever. But and again, this is beyond the scope of what we're talking about. But the ideological component of this, you have people who are driving this ideology who say, we don't like science. We don't like the idea of there's an objective reality and we're going to use the tools of rationality to investigate it. Those things aren't real. These are all, factors in a game of power dynamics, and language means what we say it means, So and I've talked about this on a previous occasion, where you have people in science who are functioning more or less as useful idiots to an ideology that hates their work. And so there's this really awkward conflict where you have people who are trying to compromise with this cultural phenomenon, but there isn't compromise. So that's my problem, I guess. I don't want to keep going on, right? But if it were confined to a handful of clinical cases like you're talking about, okay, that's a different discussion. But what we're talking about is something that's much bigger than that. And I think that's what's alarming a lot of parents like me, is this isn't, it's like when your kid goes to school now, it's quite possible that they're going to be asked to put their pronouns on an assignment, right? Why is that? That's much broader than a handful of kids like you're talking about who go, I just don't feel I was born in the right body, right? It's much bigger than that is all.
Okay. I hear what you're saying. I find it easier to cleave the two apart, because then I don't have to have all the angst of the rest of it, and I can just with a wave of my hand say that this is just the lunatic speaking, and they should be ignored. It's interesting to see, in the emails that I get personally, my pronouns are at the end of the letter after the signature or whatever it would be. It's email. Nobody signs anything. I've seen the rise of my pronouns are, and now I see that they're beginning to disappear again. So that cultural moment has gone, maybe.
I hope so. That would be excellent. But in any case, we'll leave it there. Everyone's got their strongly held opinions on this, and we'll see what happens. But as always, Chuck is a great sounding board, great dialogue partner, because a lot of people won't do what we just did. And in fact, I changed my mind, Chuck. You are canceled. You are fired. You may not have an opinion on anything. Do you have a contract?
Not with you.
All right, we'll wrap it up there. Again, the article, very, very non-inflammatory. Pediatrics for Hypocrites, AAP slams glyphosate, endorses gender-affirming care for kids. Go read that. Leave us a comment. We have some commenters in the section calling me a McCarthyite and a shill and a hypocrite. So yeah, good times. Good times had by all. Follow us on Twitter. It's at ACSH.org. I'm at CamJEnglish. Chuck's not there because he's the smart one. Send your comments and questions to us. We'll make sure they get to him. Go to the website, acsh.org. Click the subscribe tab. Type in your email. We'll send you the articles that we discuss. Thank you as always. See you next time.
What?